This month, we're celebrating another milestone as a trust. Getting building back working on the Midland Met is really important. Over the last 5 years, we've worked really hard to invest in, develop and give priority to community-based services that support people in their own home. Projects like early supported discharge after a stroke or admission avoidance services in eye cares. Big collaborations like our end-of-life care hub and real success stories of improvement like the region-leading health visiting work that we do. Around 200 community-based beds now exist in Ladywood, Sandwell and Perry Barr that did not exist when we had the outline business case approved for the new hospital in 2014. In terms of out-of-hospital care, we're almost there. We've been investing too at Sandwell. There's still a lot to go and do, and the site won't be finished until 2023. Because of that, some teams will be based in the old Hallam building and will need to stay there for a little longer. We're working hard though to create clinical administrative hubs on the 5th and 1st floor of the hospital site to house our clinical teams and their admin support. 3rd floor theatres stay to support short stay surgery, and chemotherapy and medical infusion space will be there too. The existing emergency department at Sandwell will become an urgent care centre, and that can't come soon enough with the Parsonage Street Walk-in Centre closing in 2021. Over at City, we've invested to move our cardiac rehab, pain management and physiotherapy services, along with occupational therapy, into Sheldon. Fracture clinic and oral surgery go into the treatment centre. And when children's services move to the Midland Met, audiology moves out of those porter cabins into the treatment centre itself. This coming year, the board is considering what final changes we want to make sure the Birmingham and Midland Eye Centre is up to date and ready to provide region-leading specialist eye care. So much to do there too, with a football pitch and a car park coming to the site as well. So now turning back to Midland Met. You know we plan to open in 2022. 9 floors of clinical space and a 1,700 space car park underneath. Development plans go down to the canal, and there's work to do to make sure that there's more than just a McDonald's around the corner. So that's why we're working really closely with both councils, the West Midlands Combined Authority, local enterprise partnerships and the Canals and Rivers Trust to try and regenerate the area. There's a couple of new things about the hospital that I thought on today's momentous occasion you might want to know. From the end of this month, you can go along to either of our education centres and take a look at the Midland Met. That's because there'll be virtual reality touring headsets available in our libraries and education centres. So pop in over lunch or before work and take a tour of the site. Get a sense of the scale and the colour, where your department is against other departments and how things fit together. Using the VR is scary and exciting at the same time. You'll get a sense of the real scale of the hospital. And we've also made another decision. Midland Met will still be Midland Met, but to give it her full title, our new build will open as the Midland Metropolitan University Hospital. That recognises the abiding excellence of the work we do with Birmingham University, with Wolverhampton and with Birmingham City too. But it also symbolises this year's first clinical launch of the Aston Medical School, of which our trust is by some distance the largest party. So we want Midland Met to begin now to be the place you think about when you're planning change, when you're buying equipment, when you're recruiting, or thinking about what training you and your teams need to do over the next couple of years. There's no point moving in and then making a plan. We need our plan now with your plan nested in it before we move. Remember, that's not the plan to relocate. It's the plan to deliver 7-day-a-week acute services. The plan where our wards are filled with patients moving around, using kitchens themselves, going to the 5th floor to relax, ending pyjama paralysis by design. Now, you could be listening to me thinking this is a pipe dream. Well, of course it is, unless we grab the chance we've been given. Every OT, every physio, every nurse, every healthcare assistant, our new nursing associates, our doctors in training, all need to see the move as a chance for us to change some of what we do without losing any of our traditions, trying to make the Midland Metropolitan University Hospital something just a little bit special. The idea is that we are more than a hospital. That's a simple idea. Midland Met is a place where we want kids in schools to think about and be inspired by. That's why it's fantastic that University of Birmingham third-year medical students from next year will be in primary schools in the borough. Midland Met should be a place that supports clean air and environmental health. We'll work with ENGIE as our strategic partner, but we've not forgotten little details too, like bus routes, cycle access and spaces for exercise. Midland Met will be our hub for equipment and distribution across the whole of our organisation. Some of that distribution will be by hand, but you know that some of it will be by robot. So in that sense, it will be the heart of our work as an organisation. There's very distinct children's services in Midland Met. Specialist units like sickle cell and gynecological cancer, more critical care and monitored bed capacity, modern theatres and decent touchscreen IT. But maybe most importantly, there's room in the new hospital for you. Care is sometimes exhausting and everyone needs places to go and think, gather yourself and find some energy. So both indoors and outdoors, we have space for you to go. Sport and food, art and music. We're wanting to raise the standard in the University Hospital, not just for our patients, but for what it means to work in our organisation. We want to be proud of what we can do, and we want the Midland Met to symbolise that confidence and that pride. So the countdown is on now. You can even get a t-shirt to show your support. Let's make our new hospital, our new University Hospital, the heartbeat of the communities that we serve.